Australia, and it's actually Thursday here, so it's really good that the time zone allows us to come online at a good time of day for us. A bit of self-disclosure, we've actually got our students doing their exam in a little less than half an hour, so we might have to talk a little bit quickly because we've got to rush off and invigilate. But we are presenting together on a couple of alternative assessments within the Bachelor of Radiation Therapy program, into which we both teach. Excuse me. So radiation therapy is a 4-year undergrad program, and we have academic and clinical courses or subjects that alternate over the first 3 years. But it's predominantly clinical placements that are happening in 4th year. So you might cast your eyes over our grid and see the 4 years and notice that we've got quite a few clinical blocks, which are the sections in red. So in late 2019, the Australian Technology Network of Tertiary Institutions got together and they agreed that authentic assessments, that is those that are realistic and related to the future work of students, are core to enabling students to become the work-ready graduates that Australia needs. And they released this statement in January 2020. In 2021, UniSA, which is our university, released its academic enterprise plan, which included the Authentic Assessment Project as a key priority action. So this project supports the recognition of and movement towards more authentic forms of assessment, instilling graduate qualities and job-ready skills within our students. So today we will present on 2 examples of authentic assessment that were implemented into our 4th year of our program. So as students progress through their final year, they're working towards being a registered practitioner, and we want them to be competent in a range of procedures. They're also preparing to enter the workforce, applying for graduate positions upon completion. So here you can see the time points of a mock interview assessment and CT competency testing on campus. And I will talk firstly about the CT competency tests. So being able to acquire a computed tomography or CT scan, or some people call them CAT scans, so that fancy X-ray image, to plan radiation treatment for a range of cancer diagnosis is a core skill of registered radiation therapists. Up until midway through the 4th year, students really only participate in these tasks clinically, and they're not really tested for competency until the second half of the year. And this has been managed in their clinical placements, and students are tested by their supervisors out in the hospitals on a range of skill elements. So in the pictures there, you can see what is representative of 2 different patients who are having their CT scan. The one on the left has an immobilization shell on, so they're positioned for their scan and also for their treatment for something that is occurring in the head and neck region. And then the other image is showing a patient who's kind of raised up, and they're lying with their arms up in a position that would enable breast treatment. So students are expected to have competency in a range of different procedures, and as I said, this is tested in year 4 clinically. So here is the CT competency form, and you can see a range of skill elements and their descriptors that students work towards achieving competency in. And it's very much a clinical competency, and the students are sometimes quite anxious about this increase in expectation. But prior to placement, we have preclinical workshops that are held on campus throughout the year. And so this year we introduced a CT simulated competency assessment prior to completing these clinically. So during the preclinical workshop, all practical sessions were conducted in student pairs, and specifically the same pair of students worked together throughout the week. This highlighted the opportunity to develop teamwork skills and familiarity by practicing a range of skills together. As you can see, students practiced the CT competency together, and then they were tested together. They also worked together on some untested skill development, and both acted as the role of the patient as well. The actual CT competency test was either a brain patient with an immobilisation mask or a breast patient. Taking the test in pairs was far less nerve-wracking, and it promoted the observation of teamwork, which is also realistic clinically. Another student was nominated to act as a brain or a breast patient, and all students have a mask made in year 2, so they could use this or they could wear a breast trainer as pictured. The type of procedure was not known until the time of the test, when the testing pair were given the CT request containing the patient's name and diagnosis. So you can see the 2 little mock-ups there of the CT SIM request. You can see Mark, the diagnosis is a right glioma, which is a brain tumour, and then Susan on the right, which is a left breast, and they're both post-surgery. So this is the information that the students were given. They had their patient actor, and then they had to perform the procedure following a protocol. So they followed their protocol for each body site, and students performed all elements of the procedure using authentic equipment and CT simulated software. They took measurements, they completed documentation, and acquired the CT images whilst communicating with their team member and, of course, communicating with the patient, which is really important skill to develop. In completing the competency form, there was a variety of realistic and simulated tasks assessed, and we were able to observe all of these things and marry them up with the competency form, and this was very effective. The added element of Siemens CT simulator software allowed students to mimic the clinical look of acquiring images. They could enter patient record details to register their patient, select the appropriate protocol, and so the picture on the screen there, you can see that cursor is just selecting that protocol, so either a head or a thorax, and then progress the screens that are the clinical imaging tasks. So you can see that the screens change with the different points that they have to work their way through in acquiring the CT data set. Also of importance is the clinical documentation, which is populated electronically for the appropriate site. So students completed the measurements and recorded positioning details for their patient, and we got them to submit this documentation as part of their competency test. So you can see a student there populating it in her laptop, and then you can see a screenshot of the detail that would have been recorded. And each student pair produced this documentation for their particular procedure. The tests were all completed in a normal appointment time of approximately 20 minutes, with time at the end for feedback and signing their forms. And at the end of the workshop, an evaluation quiz had 2 dedicated questions that related to the CT testing. So the first was just a rating of the practice sessions based on their value for learning. And as you can see, this was rated very highly. And the second was free text, and it was seeking general feedback on this approach to competency testing on campus, because this was the first time that it had been conducted. And so we wanted the students to know that it was something new and to seek their feelings on how effective they thought it was. So here are the free text responses, and I've highlighted some of the common themes. The working in pairs was identified quite a few times and was valuable for building teamwork. Also mentioned was confidence building and practices being good preparation for placement and good preparation for the clinical testing. Multiple types of patient setups, practicing workflow and communication, of course, were also featured in this feedback. So this activity overall was very well received. It was realistic, and it was certainly good preparation for their clinical placement. So overall, quite a successful thing to try out. So Lisa is now going to present on the second alternative assessment of the mock interview. So I'll hand her over now.
Hello, the mock interview is an assessment piece that was completed by those same final year students. This assessment sits in the second clinical course of the year, which runs from May to June. Prior to going out on clinical placement, students attend workshops on campus, which are run by career advisors. So they teach them specific skills in CV writing and interview skills, also encouraging them to start thinking about their professional profile and planning for their future careers. So then after they go out on clinical placement, excuse me, the students complete the assessment, which is in two parts. So the first part of the assessment is to respond to a fictional job advertisement. The students have to submit a CV and a written response to selection criteria, where they're able to immediately apply those new skills that they started learning in the workshop. The second part of the assessment is to follow up from the job advertisement and sit a mock job interview that's held over Zoom. So the interviews, like I said, are held over Zoom during their clinical placement block. So by having the interviews during clinical placement, the scenario actually replicates quite closely what will happen later in the year. So if you cast your mind back to that clinical map where we saw the red blocks of placement ran all the way across fourth year. So very often our students find themselves in the situation in the second half of the year when they're on clinical placement and they have to navigate having job interviews for their graduate positions. So as this assessment in the first half of the year, they need to arrange time away from the clinical day to complete the interview. So they have to think about communicating that with their supervisors, as well as becoming familiar with the technical requirements of using Zoom, how to log into the meeting, making sure that they have reliable internet, what computer they're going to use, and finding an appropriate location to join the meeting. So booking a room or, working their schedule around that appointment. And increasingly over the last couple of years, we've found that student graduate interviews at the end of the year are being held via Zoom. Our students here in South Australia are also often applying for jobs interstate, so all around the country. The questions in the interview include personal, scenario-based and technical examples. So the personal responses to the interview questions require students to think critically about themselves as professionals and use reflective practice, where the technical questions allow us to test their theory knowledge of some basic radiotherapy principles that we know they should all be able to answer at that point. The interviewers are former radiotherapy clinicians who no longer work in the clinical setting. So this specific requirement for choosing our assessors means that our interviewers have knowledge of the profession because they used to work as radiation therapists. So we know that they can accurately assess the responses to the technical questions. And they also have all been involved in radiotherapy interviews in the past. So they've all been involved in recruitment and have acted as interviewers in a real life setting. But importantly, there's no conflict of interest because they're no longer involved as radiotherapy clinicians. So one of our interviewers is working as a vendor rep, another one was a retired RT. So that means they're not involved in current clinical placements and assessing the students on placement, and they won't be involved in future graduate recruitment. So this assessment gives students interview practice in a realistic setting where the pressure of sitting an assessment helps to prepare the students for the pressure of real life interviews. The feedback that they get from the former clinicians is invaluable. The assessors are able to give students feedback on their technical answers and on their communication skills, as well as on their professionalism and their presentation. So this year, the students got feedback on, for example, the location. One of the students sat their interview outside and they got specific feedback about the noise that was occurring in the background, and that wasn't, very professional. The mock interview assessment has been held for 2 years now in our program. And next year, we're hoping to formally evaluate how effective that assessment is in regards to helping students prepare for their job interviews later in the year with a formal project. However, at this point, we've got anecdotal evidence and informal feedback from students and clinicians, which has been really positive. This quote from a student who is a graduate from last year and is now working as a radiation therapist in Australia sums up exactly what we were trying to achieve with the assessment. She found it helpful to prepare her for her job interviews later in the year. She found she was just as nervous and, had that pressure, which helped her to prepare. And she said that the feedback that she received was relevant and constructive. So as Eileen mentioned earlier, authentic assessment is a priority area for UniSA now and also looking into the future. So this definition of authentic assessment on your screen was created this year by a working group made up of representatives from across the university, led by our Teaching Innovation Unit. The top 3 elements should be present in all assessment we recognised. So all assessment should be valid, reliable and fair, promote academic integrity and provide feedback that is actionable. However, the group defined these 5 attributes at the bottom that are key to effective, authentic assessment. And so considering the 2 examples that we have presented today, we can see that both of those connect learning to real life, certainly. Do the tasks resemble and complement those used in professional practice now and in the future? Yes, we can certainly guarantee that they do. Do they motivate students to become problem solvers? Yes. Those 2 simulated real life scenarios definitely encourage the students to use realistic problem solving that they'll be using throughout the year. Do they stimulate students to think from multiple perspectives? Yes, they certainly posed complex and messy problems in the definition here, where students needed to think from multiple perspectives, including from that of the patient. Obviously, we want to produce clinicians who have patient-centered care at the forefront, so encouraging them to think from the patient's perspective is always important. Did it inspire the application of relevant knowledge and skills? Yes. Tasks were meaningful and relevant, as reflected directly by those comments in the student evaluations for both tasks. And did it encourage students to adopt higher order thinking? Yes, they needed to analyse, evaluate and demonstrate critical thinking in both of those tasks. This definition is available on the UniSA website, and it's certainly an interesting way to think about our alternative assessments, where the focus of these assessments is certainly student-centred and has in our examples been effective in producing job-ready graduates. So I'd like to thank you for joining us today, and our contact details are on the screen, so we're happy to continue discussing, and I think we do have a little bit of time for questions now, but so I think Eileen mentioned we have got 2 groups of students sitting in exam this morning, so there's a bit of nerves and a bit of things we need to run off to, but happy to take any questions for a couple of minutes.
Hi, both. I have a question. Thank you so much for making the time. I'm Lisa. I'm in Toronto, Canada, working as an educational developer, and I work with our Faculty of Health. So everything that you've talked about resonates. And knowing that you have places to go, I'll ask a question, even though I have very many. When you talk about the assessments in pairs, what resonates with me is some of our students find teamwork really challenging in a lot of different settings and may find it particularly challenging if they're being assessed or evaluated. So I'm curious if you have any thoughts, and I'll certainly follow up with you by email later, but I'm curious if you have any thoughts around, or maybe you've done this, how to address that potential challenge, or maybe you didn't see it, but what it's like for students to maybe feel challenged by being assessed as a team. We see that a lot in the work that we do in health and otherwise. I'm just curious if you have any thoughts or reactions to that.
Well, I would just say, I think the student comments in this task that we did here was maybe one of the first times where they worked as a team throughout the whole week. And that was very effective in that because they did maybe 5 tasks over the week in those pairs before the assessment. So they were able to kind of work out their effective teamwork and practice that before the assessment.
Yeah, it was definitely something that was raised in the feedback, and they developed that feeling of comfort of being with the same person and building that skill together before they were assessed together. But I guess I understand your point about students finding a challenge in being assessed as a group, particularly if the group keeps changing all the time. It can be quite unsettling. I guess it's part and parcel of academic assessment, isn't it? You know, there is a lot of group work. It's a little bit more easier for academics to manage from a marking point of view. When I've done group assessments, I try and make part of the assessment individual so that not all the marks are attached to that group outcome. And that, you know, there is some emphasis put on individual effort as well. But look, it's probably a challenge for academics as well, I would suggest.
Yeah, thank you. That makes a lot of sense. And I appreciate what you said about they have time to build that trust and the cohesion as a group. I think that's one thing we maybe don't do as much. A lot of the more negative reaction is get together in a group. Okay, now you've got this high stakes assignment that you're going to work on together. So I appreciate that you're talking about the forming, norming, and storming in the group as an integral part. That makes a lot of sense. Thank you.
Yeah.
And I think probably our role as radiation therapists is always working in pairs. So these final year students are used to that workflow always being in pairs. But the difference with the clinical environment is the students are always lower in the hierarchy, but obviously in our simulated settings, what we sometimes do, which we didn't probably have to do for this one, is we might assign number 1 and number 2. So number 1's going to lead this time, and then next time this person's number 1 and they'll lead. So that kind of helps to work out the hierarchy that doesn't